What do you think about war against humanity with the corona crisis and vaccination?
Well, let me put this in perspective. I spent 2 years researching that and also in publishing a book which was released in electronic form in English, and it's now in French and Spanish, and it came out in Japanese as a regular book. It was my publisher in Japan who published it. I should say that this is probably the most serious crisis in world history, because it was based on a string of lies and scientific and fraudulent manipulations, and it led to some very significant consequences. And it was visible right from the beginning that this was a fraud, even in January 2020. Why? Because the World Health Organization on January 30th comes up with a statement that it is calling for an emergency at the level of the entire planet. It was called, it was called specifically, it had a technical name, but it was nonetheless at the level of the entire planet that they announced the dangers of this virus. Now, and they said it's an upcoming epidemic, etc., etc. How many cases was there on the 30th of January 2020? Outside China, 83 cases for a population of 6.4 billion people, and the Director General of the Tedros of the WHO declares an emergency of international concern. Now, that was worldwide. It was not necessarily followed with specific measures, although the following day Trump discontinues air transport with China, and subsequently leads to a crisis, a generalized crisis in air travel. But bear in mind, the most significant, there's several stages in this crisis, and I'm going to summarize it in a sense. We first had the issue of the pandemic, which was announced on the 20th of February 2020. Now, on the February 2020, the Director General of the WHO said, we can consult his statement. He said, I'm paraphrasing, the pandemic is imminent, the windows are closing, that he said, the windows are closing, we must take measures, etc., etc. He makes a speech, and then he says there are 1,076 cases outside of China worldwide. 1,076 cases. And the thing is that his statement then led to the crash of the financial markets. Okay? Now, whoever has an understanding of financial markets, they will know that a statement, and foreknowledge of that statement, you can speculate derivative trade, and you will make billions in one day. Now, mind you, that Tedros was supported by the Bill and Melinda Gates Foundation, and his statement borders on ridicule. 1,076 cases, and in fact, it was far less than that. But that's in my book. But we then get into March 11. Now, everybody worldwide remembers March 11. That was a statement made by the same Director General of the World Health Organization. He declares the pandemic, and then the pandemic requires certain features, namely what was called the lockdown, which means that people stay in their homes and they don't go to work. So there are people staying in their homes and they don't go to work. Then there's the mask. Then there's social distancing. Then there's a whole series of measures which affect people's relations with one another, with cultural events, etc., etc. I will ask my students in first year of economics, what happens if the World Health Organization demands and requires that people in 190 countries, member states of the UN, it's 193, are ordered to stay home and not go to work. And the workplace is paralyzed. Now, of course, that didn't happen in absolute terms, but those were instructions that were handed. The government said, no, you stay at home, you wear the haste, and it's only necessary movements. You can go to the supermarket to buy things and so on. But on March 11, there were 44,279 cases, but the unspoken agenda is engineered economic collapse, real economy. Everything collapses simultaneously. And you can compare that to a neoliberal policy.
Exactly.
It's not it was not tagged as a neoliberal policy, but it means you stop producing, the workers go home, there's high levels of unemployment, there's poverty, depending on the country and so on, but it's complex. But if you ask an economist, why did we have this financial crash a few days after, well, there were several financial crashes, but why did we have a financial crash? And they said, well, it was the virus that triggered no, I'm serious. It was the virus that triggered the collapse.
Everything was
I know of not a single economist on the planet will say, no, it was orders given by obedient governments worldwide to confine the labor force and to freeze the workplace. That is the whole basis of economic growth. If you confine people, they're workers, okay? They're teachers, they're workers, they're nurses, whatever. Well, the nurses would be in the hospitals, and so how is it that people didn't understand? First of all, the numbers were ridiculously low, even 44,279 cases cumulative since the beginning of January, using a test which is called the PCR test, which is totally invalid. So there you are. They came with a logic and a narrative which led to the closing down of the entire planet. I'm exaggerating, obviously, because it wasn't an entire closure. Certain sectors remained open, etc. But we lived through that, and we lived it, and we experienced it, and then we ask, well, how? What's the logic of that? Even let's say that the virus exists. It's not by keeping people at home and and preventing them to go to work. There are other solutions. And even seasonal influenza, the numbers are in the millions here.
Exactly.
And so there was no evidence of anything resembling an epidemic. And I have done other research on that I say there's no evidence there was a virus. No evidence that there was a virus. And that's a little bit complicated because you notice that the name of the virus changed from, it was identified as a new virus, so it was CONV. It had several names, but it was identified as a new virus. And then in the month of February, they changed the name to SARS-CoV-2. Now, SARS-CoV-2, the 2 stands for the fact that there was a virus in the 2003, 2002, 2003, which was called SARS. It's symptom of a respiratory, it's a respiratory symptom, okay? But what they did is they said, we don't have an isolate for this new virus, and consequently we need to have an isolate to determine its identity. And then the Berlin Virology Institute, which was funded by the Gates Foundation, said, well, we have a similar virus of the year 2003. It's similar to the new virus. How can they say that it's similar? Because they can't identify it. But that's another matter. But then the virus was changed to SARS-CoV-2. That means that it's a variant of a virus that existed 20 years ago. All this is documented, and it was given a scientific basis. Everything that I put in this book is corroborated with official data. When I say there are 83 cases and then they declare a worldwide emergency, it's 83 cases. It's obviously a lie and it's fraud.
If everything is staged, how can somebody be now responsible? Is it possible to call somebody on certain court? What do you think? Is it possible that there will be consequences to the people who pre-plan this for all the planet Earth? Because we are all the victims of this tyranny.
No, but the damage has been made. When you come up, if you had a real pandemic, it's most important that your economy continues to function, because the economy is what finances also public health and support to students or whatever. But in fact, there was support by Western governments, and it took the form essentially as compensation, which then was conducive to pushing up the debt. Okay. Now, when we get into the issue of the vaccine, first of all, the mRNA vaccine is not a vaccine, because it modifies the human genome. It is not a vaccine, and it can't be a vaccine to something which doesn't exist. They haven't been able to identify it. But what is fairly well established, and it was established within 3 months of the launching of the vaccine. The vaccine was launched in December 2020, and in the first few months, we already had an upward trend in mortality, and I can say that the upward trends in mortality they're verified. There's absolutely no doubt. There are 2 methods. There's excess mortality, which commenced essentially in early 21, and well, that's the easiest way of focusing on the trend in mortality. The trend in mortality went way up. Now, if you look at global movements of mortality and morbidity, it's corroborated. And there have been studies which have been done at different levels. But now you see how they are saying, mortality, cancers and heart attacks are not due to the vaccine. They're due to other factors. Okay, but they want to now, in a sense, continue with this vaccine program on the grounds that it's not the vaccine that causes death, it's some other factor. But that other factor is very hard to explain, and the timeline is very, very clear. But what is very important there is that more than 75% of the world population has been vaccinated at least 2 times, and some much more than that. So we're not dealing with something at the level of a few countries. It is at the level of the entire planet. And this is going to have a dramatic impact on mortality and morbidity for years to come. We see that some people are dying in the very short term, 1 or 2 years. And we see the impact on children, and so on. So those are the 2 main components of this project, and what coupled with the disintegration of civil society, the penalties imposed on people for not wearing a mask, the paralysis of sport events, the Olympic Games, and so on. It is beyond description, and it all is based on a big lie, on a really big lie. And I have proven that it is a big lie, because my training is in statistics and mathematics. I always look at the data, and I can say from the data, this is a big lie. And then I can establish that the levels of mortality started to go up worldwide immediately in the wake of the implementation of the vaccine. Mind you, the lockdown also resulted in mortality and morbidity. Why? Because it paralyzed the economies of countries all over the world. It had effect on the consumption and availability of food. It triggered bankruptcies of small enterprises, and so on and so forth. So that it's not strictly mortality associated with the vaccine. It's the whole process it's the poverty which is generated. I looked at the situation in India, where they said you must stay at home. You're not allowed to work. And if you look at some of the cities in India, particularly Mumbai, you will see that a large segment of the labor force are homeless. They come from villages, they come to the city, and they're homeless. Where do they go? The Modi government says, go back to your village. And they sent them back to the village. And you can well understand, if anybody knows the geography of India, if you send people back to their villages, which are maybe several hundred kilometers away, and they don't have money to take public transport, and they're not allowed to take public transport because they could infect people, well, they die en route. That was not covered in the media. I looked into various aspects of it. It wasn't covered in the media. But I know that that the social impact of that lockdown was devastating, and you have to apply common sense, and that's if I ask somebody who's not necessarily a prominent intellectual, and I say, what happens if you forget about the WHO? What happens if people of the entire country are instructed to stay at home and not to go to work, and your workplace is closed down? The answer is obvious. It's the most serious economic crisis in world history.